Well, hey guys, welcome to the Otter Creek Fire Department. My name's Chris and I'm a paramedic with the County Ambulance Service Transcare. We're stationed up here at Otter Creek Fire Department Station number 1, located just north of Terre Haute. Over the next couple of minutes, I'm going to be talking about the career field of emergency medical services, or EMS. I'm going to talk about what it takes to become an EMT or a paramedic, the things that you can do to better prepare, and the kinds of things that we see on a daily basis here in EMS. First, let's take a ride in the ambulance and take a look at some of the things that we do during our job. Well, I'm a paramedic, and in emergency medical services, you basically have two levels of healthcare providers. You have EMTs, which is the entry-level position, and then you have the paramedic. I've been a paramedic for about 15 years, and I was an EMT for 3 years before that. As a paramedic, my primary role is to bring an element of emergency room care to a patient in their house, on the side of a road, in a park, wherever it may be. So someone basically calls 911 when they're having a medical emergency. They could be sick, they could be injured, whatever it may be. We get into the ambulance and then we respond to the scene. Once we're there, we assess the patient, we come up with a treatment plan, and then we provide appropriate medical care to the patient, just like nurses and doctors would inside the emergency room at a hospital. Well, there are two levels of EMS providers. You have the basic level, which is the emergency medical technician, or EMT, and then you have the advanced level, which is the paramedic. To become a paramedic, you first have to become an EMT. EMT schooling is roughly 165 hours of classroom time, plus dozens of hours of clinical time, where you actually go into the hospital environment, you go onto the ambulances, and you actually treat patients. Now, how you obtain those hours can vary. There are some programs that do it in as little as 2 weeks, where you're there every single day for 2 weeks for 14 hours a day, but the typical program has you in class a couple of nights a week for 3 to 5 months worth of time. Once you're done with class, you actually have to take a national certification examination to the National Registry of EMTs, and then you also have to take a skills exam through the Indiana Department of Homeland Security EMS Commission. Once you pass those exams, you're certified as an EMT, and then that's good for 2 years. When you're finished with EMT school, if you decide to go into paramedic school, you have a couple different options to do that as well. Paramedic training is a lot longer than EMT school and typically takes 18 to 24 months depending on which route you go to do it. If you go a non-degree route, such as through a hospital paramedic education program, that usually takes about 12 months to 18 months. And it is focused primarily on the patient care aspect of paramedicine. You'll learn about anatomy and physiology, medication administration, patient assessment, airway management, cardiology, pulmonology, medical and traumatic diseases, obstetrics, pediatrics, and everything in between. But that's pretty much all you focus on. And then when you're done with that, you'll become certified. If you go the degree route, you have to take all the general education courses that you would typically take when pursuing a college degree, plus everything else that I just discussed. And then when you're complete with that education, you actually will obtain a college degree. Locally in Indiana, the only degree programs for the paramedic are associate's degree programs or 2-year programs. However, there are some states in the country that have a 4-year bachelor's degree program. in paramedicine. My day begins with waking up at about 6 o'clock in the morning. My shift begins at 7 a.m. We work 24-hour shifts. That's right, 24-hour shifts, which means we come in at 7 o'clock in the morning and then we don't get off until 7 o'clock the next morning. We're here for an entire day. When I show up for work, we start out by checking off all the equipment on the ambulance, kind of like you saw me doing at the beginning of this video. We make sure we have all of our tools, the equipment's working, the monitor and the defibrillator is working, we have enough oxygen, all of our medications are present, everything we may need to treat a patient that day. After we do that, we fill out some paperwork on our computer tablets showing that we've checked off the truck, make sure that we don't have any runs pending for us right away, and then we basically head up to our station. Now, depending on what kind of ambulance service you're talking about, ambulances may be stationed at firehouses, they may be stationed at hospitals, or they may be stationed at standalone ambulance stations. We are stationed at a firehouse. So we live in that firehouse for the entire 24 hours that we're on shift. And so it basically is like a big house. It has everything that you would find in a normal house like you live in. It has bedrooms that we sleep in. It has a kitchen that we obviously cook and eat in. It has a big living area that we can relax in and watch TV, an area to take our showers, an area to do our laundry. We also have a large training room where we attend trainings to make sure we're staying up on our education and our skills. And we even have a fitness center so that way we can stay healthy and keep our bodies in shape. Throughout the day, we might do some training, we might be doing chores around the house, we may be doing some skills work, or maybe just resting and relaxing. When a call comes in, we drop everything, we get into the ambulance and we respond to the call as quickly as possible. We take care of the patients on scene and in the back of the ambulance, and we transport them to the hospital. Now, depending on what's going on with that patient, we may be giving them simple things such as oxygen. We might be putting IVs in them and giving them medications. Sometimes patients are really sick and we have to provide critical care to them. We have to do things such as putting breathing tubes into them and breathe for them because they're not able to breathe well enough on their own. Maybe we have to give them IV fluids. There's all types of things that we do in the back of the ambulance. So sometimes we'll be sitting there on scene for a little bit because, like I said earlier, we can actually bring an element of emergency room care to the patient. A lot of people don't realize that, and they think we just show up, put the patient on a stretcher, load them into the ambulance, and then take them to the hospital. But that is not what we do. There's actually a lot more to it than that. The thing I love about my job the most is being able to help people. That's one of the main reasons that I got into this. When people call us, it's typically because they're having one of the worst days of their lives. We can show up and we can mitigate whatever problem that they're having. If they're having issues breathing, we make them breathe easier. If they're having chest pain, we relieve their chest pain. Whatever it may be. We may not be able to solve the problem definitively, but we can make them more comfortable, we can give them a shoulder to lean on, and we can get them safely to the hospital while providing that medical care to them. And hopefully, by doing that, can make that bad day a little better for them. EMS is not easy. It's not easy at all. There is much more to this profession than being an ambulance driver. We're EMTs and we're paramedics that respond to people who are having sometimes life-threatening emergencies. You are going to see a lot of bad stuff if you choose to go into this profession. We're going to see people on the worst days of their lives. This is just the truth. I don't want to sugarcoat it. It is what it is. People are sick, people are injured, and we're being called to help them. You're going to see things that some people don't see in their entire lives, and you're going to see it a couple times in 1 week. But if you can get past that, and you can focus on the good, and you can focus on helping people and bringing that aid to them in their time of need, it's absolutely worth it. For anyone wanting to pursue a career in EMS, I say this. Number one, make sure you can read. Make sure you take math classes because there's a lot of medication administration that has to be done, and math is a big part of that. Make sure that you take science classes, biology, human anatomy, and physiology. That will help you tremendously in this profession. And also, if you're really thinking about a career in EMS, do a ride-along with your local EMS service. They allow people to come and do ride-alongs all the time. That will allow you to immerse yourself in the field without actually having to sign up and take the time and money and put in the effort to go through training and then find out you don't like it. You can do a ride along, you can see if it's something you'd be interested in doing, and then you can make a decision from there. Also look into the different types of EMS providers that you have. There's all kinds of different models for EMS organizations. Some are fire-based, meaning the fire departments provide the ambulance service. For example, the Terre Haute Fire Department runs an ambulance service as part of the department. There are private and county-run services such as TransCare, the company that I work for, which is solely an ambulance service. We don't do fire suppression. There are hospital-based services, there's military services, and even in some states, there are police departments that run ambulance services. So investigate your options as you're getting to that point when you realize it's a career you want to go into. Also, like I discussed earlier, there are multiple options to choose from as far as how you're actually going to obtain your training. Do you want to have a degree? Degrees can help sometimes in giving you a little bit more money salary-wise, but as far as the core patient care component of it, there isn't much difference between a hospital non-degree program and a degree program. But it's never a bad idea to go ahead and get that extra education because it can always help you in the long run. Well, I hope you guys have enjoyed this behind-the-scenes look at the career field of emergency medical services and what it takes to become an EMT or a paramedic. Hopefully, if you decide one day to pursue a career in EMS, you'll find it as fulfilling as I do. And if you... Oh, we're getting a call.
Investigating I-23, investigating I-23, 5701 North Plain, 5701 North Plain Street, operating difficulty.
All right, guys, we've got to go. It's time to go to work. You guys be safe out there.
32,